Thank you for joining our Debbie's Dream Foundation webinar series. Today's webinar is featuring Dottie Sheen, Senior Director of Patient Information Operations at the NCCN. I'm Jackie Bello, Programs Manager for Debbie's Dream Foundation, and I'll be moderating today's webinar. We'd like to thank our webinar sponsors, Merck, Astellas, and Bristol Myers Squibb. First, I will share information about stomach cancer and Debbie's Dream Foundation. Then we will hear a presentation on the NCCN Stomach Cancer Guidelines. The presentation will be followed by a Q&A discussion. You can type your questions throughout the presentation into the chat section that appears on the webinar menu. We will address questions at the conclusion of the presentation as time allows. This year, nearly 30,000 Americans would be diagnosed with stomach cancer. Stomach cancer is one of the leading causes of cancer deaths worldwide, with a dismal 5-year survival rate of between 20 and 30%, depending on the country. Many patients are asymptomatic during the early stages of stomach cancer, leading to a late diagnosis. Debbie's Dream Foundation is dedicated to raising awareness, advancing funding for stomach cancer research, and providing education and support internationally to patients, families, and caregivers. Our ultimate goal is to make the cure for stomach cancer a reality. Pictured here is Debbie Zellman, the founder of Debbie's Dream Foundation. Debbie was diagnosed with stage 4 stomach cancer in April of 2008. She had no risk factors and only vague symptoms. At the time, she was told her chance of being alive in 5 years was only 4%. She endured harsh chemo regimens and targeted treatments and experienced many reoccurrences over 9.5 years. Unfortunately, Debbie passed away on December 23rd of 2017 at the age of 50, after a 9.5-year battle with cancer. She dedicated herself to helping others with stomach cancer by raising awareness and providing resources and education. Debbie founded DDF in April of 2009. As an organization, we will continue her important work and legacy. In a few short years, DDF has achieved many great milestones. We have 32 chapters across the US, including Canada and Germany. Our PrEP program helps patients, their families, and caregivers match with survivor and caregiver mentors using disease-specific criteria, including stage, biomarker, and location. We host educational webinars and symposia year-round, and our website contains in-depth information about stomach cancer. We have also provided $1 million in research grants to date. COVID brings about new challenges for the cancer community. Through our COVID-19 resource program, we offer the following free resources: COVID kits that include face masks, hand sanitizer, and educational material, meal delivery support through Instacart, and mental health support services, such as our Facebook Live Mind, Body, Spirit series and our monthly stomach cancer support groups. Sign up for these free events on our website. Here you can see some of our upcoming programming. DDF is headquartered in Plantation, Florida. Our office hours are Monday through Friday, 8:30 a.m. to 5 p.m. Eastern Time. Also on the slide are important phone numbers and email addresses you can use to contact our office and staff. We will now begin the presentation on the NCCN guidelines with Dottie Sheen. Dottie is a Senior Director of Patient Information and Operations at the National Comprehensive Cancer Network. She supervises the development of all NCCN patient information initiatives, including the NCCN guidelines for patients. The expansion of the guidelines for patients continues, now covering 50 guidelines. In addition, she participates in other patient information initiatives, such as Know What Your Doctors Know webinar series. Dottie also manages the patient information team and works closely with the NCCN Foundation, panel members, and clinical information department. We will now like to thank Dottie for taking time out of our schedule today. And Dottie, I will give you mouse control and turn the presentation over to you.
Great, thank you.
Okay. All right, you should be good to go now.
Okay. So good afternoon. Thank you, Jackie, and thank you to everybody for joining us this afternoon. My name is Dottie Sheed. I am the Senior Director of Patient Information Operations at NCCN. It is my extreme pleasure to discuss the NCCN guidelines for patients with you today. Oops, sorry about that. So first, I'd like to provide a little bit of background information from NCCN. We are an alliance of leading cancer centers devoted to patient care, research, and education. Our mission is to improve and facilitate quality, effective, efficient, and accessible cancer care so that patients can live better lives. Our vision is to define and advance high quality, high value, patient-centered cancer care globally. NCCN Alliance is an alliance of member institutions from across the country. We have increased to now 30 member institutions. Of recent, UCLA Johnson Comprehensive Cancer Center and UT Southwestern Simmons has joined our organization. This slide is our team of skilled and dedicated writers that take our clinical practice guidelines and apply health literacy principles and make them easy to understand and have them as such a valuable resource for patients and their caregivers. So this is the face behind the books, and I'm so proud that I get to work with these individuals. They are absolutely amazing. So the NCCN guidelines for patients are developed by the National Comprehensive Cancer Network. So as I stated, the NCCN is an alliance of our leading cancer centers across the country, and we're devoted to patient care, research, and education. These member institutions and panel members work collectively to develop the NCCN clinical practice guidelines in oncology. So they do this by using the latest research and their years of expertise in treating various types of cancer. The clinical practice guidelines are written at a higher level. They are written for providers and medical teams. The expert recommendations cover everything from cancer screening, diagnosis, and treatment. So the NCCN guidelines for patients take the clinical practice guidelines and their recommendations and present this information in the guidelines in an easy to learn format. They are written directly for people with cancer and for those who support them, and they explain the cancer care options that are likely to have the best results. Our guidelines are made available due to funding and support from our NCCN Foundation. This slide is an overview of the development process for the patient guidelines. So as I stated, they are based on our NCCN clinical practice guidelines. So in order to start preparation, the writers must review the clinical practice guidelines that have algorithms, diagrams, principle pages, discussion sections, and the references. They must determine what content is relevant for patients and caregivers and convert that into the easy to learn format. In order to do this, the medical writers have to collaborate with our guideline coordinators, oncology scientists, pharmacists, and members of our panel to clarify any recommendations and to answer questions. So they essentially become experts in the topic themselves before they even start to draft the guidelines. Once they do that, they have to apply the health literacy principles and adjust all information to appropriate reading levels. The patient guidelines go through a medical review from our panel members. That includes the panel chair, our vice chair, and patient advocates. Edits are always incorporated, and then they are put into a very nice layout with the help of a graphic designer, which includes appropriate photos, text, figures, and anything that can help help users really understand the information. The guidelines are reviewed and revised, and updates are always included into the next version. They are posted on our website, nccn.org/patients. They are available on our mobile app, and they are also available for purchase on Amazon.com. The guidelines are updated based on changes in the corresponding clinical practice guidelines and from feedback by the user surveys. And also we take into consideration any patient information emails and our patient advocacy groups. The NCCN guidelines for patients, again, are based on the same treatment information that your doctors use. They help support patient-provider conversations regarding care options. They are step-by-step guides with the latest advances in cancer care, and they feature sections that include questions that you can take with you to ask your doctor, patient-friendly illustrations, and glossary terms with definitions and acronyms. The current NCCN library of guidelines has 53 different guidelines for patients. Some are by cancer type, and then we have other guidelines that are more supportive care, such as our distress guidelines, and our newest guidelines are for survivorship. And these guidelines are incredible. There's 2 different books. One is for healthy living, and the other one is for managing late and long-term side effects. In 2021, we will be adding at least 7 new guidelines to our library, taking us over 60 guidelines available for patients. The guidelines are accessible for free online at nccn.org/patients. It's a PDF download. There are sometimes free print copies available on our website as well, based on the availability. NCCN has a mobile app that you can also download to access the patient guidelines. And then again, that you can get print copies from Amazon.com. In 2020, more than 2.2 million downloads by over 1.5 million individuals was recorded. Again, these were available completely free of charge, and patient and caregivers in our survey overwhelmingly agree that NCCN guidelines for patients are helpful, trustworthy, and understandable. Some of the feedback that we received from patients and caregivers saying that the guidelines have a very nice design. It helps them find answers. Complex concepts have been made simple. These guidelines are absolutely necessary for anybody going through an advanced cancer. Comprehensive, they provide guidance from start to finish. They help people to better understand the complex information, and they provide advice for making treatment decisions, and especially the questions to ask doctors is really appreciated. Now I'd like to focus a little bit more on our NCCN stomach cancer guidelines. So the stomach cancer guidelines, they start out, it's divided into chapters. The first chapter provides basic information. They move into staging, an overview of the treatments, treatment guides, survivorship recommendations, making treatment decisions, the words to know, and then our NCCN contributors and cancer centers. So stomach cancer basics, the first chapter. When you've learned that you have stomach cancer, it is normal to feel shocked and confused. So the first chapter provides basic information to help you understand the upcoming tests and to provide a clearer picture of the diagnosis and assist you with treatment planning. Descriptions for testing include genetic risks, blood tests, imaging, and in addition, a nutritional assessment, and even tips for helping to quit smoking. The cancer staging is often staged twice, both initially and with information gained after surgery. The staging system is the TNM system. And the cancer staging is the rate of how far your cancer has spread. The rating is based on the test results and is used to help determine what treatments will be needed. This section provides descriptions of the different types of treatments and will be helpful for during your course of your treatment. Excuse me. Not everybody will receive every type of treatment that is described, but it is definitely helpful to know what options are available. So treatment guides. Treatment options are grouped by the extent of cancer. So the early stomach cancer, local regional stomach cancer, and metastatic stomach cancer. This information is taken from the guidelines written by NCCN experts for doctors who treat stomach cancer. So this information is directly from the clinical practice guidelines, and it is based on all of the recommendations that have been discussed annually and even during interim updates when there is an FDA approval. And it is placed into the clinical practice guidelines and then added into our patient versions. So this slide here is an example of what it looks like in the clinical practice guideline, and then how it can be changed and incorporated in for patient friendly. So in survivorship, there is a very large section in the guidelines for survivorship. An individual is considered a survivor from the time of diagnosis, during and immediately after treatment, and throughout the balance of his or her life. Survivorship focuses on the impact of both the diagnosis and treatment of cancer on the survivor. This includes potential impact on health, physical and mental states, financial issues, and managing long-term side effects. It is important to stay connected with your primary care provider, have a healthy lifestyle, and manage long-term side effects. This is a snippet of the survivorship section in our stomach cancer guidelines. And in addition, as I mentioned previously, NCCN has developed two survivorship series, the first one for healthy living, and a second one for late and long-term related side effects. These are brand new. They were published just at the end of 2020, and they are a very nice accompanying piece. Making treatment decisions. So in this section, there are lists of questions that you can ask your doctor. They're very helpful to bring them with you to discuss with your medical team regarding everything from your cancer diagnosis to coverage and experience. You can weigh your options. There's no single treatment practice that is best for all patients. There is a section for second opinions and also seeking out support groups. There's also another area where you can compare benefits and downsides of different treatment types. And at the end of the book, there's a list of websites that you can go to that are reliable resources for your type of cancer. Debbie's Dream includes the NCCN, the guidelines, stomach cancer guidelines in their Be Prepared kits. These kits are free and available by just requesting it through debbiesdream.org, or you can email programs at debbiesdream.org. The kit includes the NCCN guidelines, clinical trial information, mentoring service information, nutritional resources, and much more. NCCN also received funding and has translated the stomach cancer guidelines into several different languages. These are also all available on our website for free for download. So I'd like to thank you for your time today. And if you have any questions, I'm happy to answer them.
Thank you so much, Dottie. Okay, we did have some questions come through during the presentation. Okay, the first one is, how often are the NCCN guidelines updated?
Sure. So the NCCN clinical practice guidelines are updated at least annually. And then at any time there's a new FDA indication, there could be an interim update. The patient version, they are funding dependent, so they are not updated as frequently. However, we try to make sure that they are updated at least every 18 months. And I can say, so for stomach cancer, we just received approval. We will be updating this version of our stomach cancer guidelines based on a 2021 clinical practice guideline, and it will be available to the public in September of this year.
Very exciting.
Yes.
Okay, next question. Who makes decisions on the NCCN content?
Well, the content is based on the clinical practice guidelines. So the decisions of whether a recommendation is included in those guidelines is really based on the panel discussion and the evidence that is available for the treatment recommendations. When that information is being added into a patient version, the medical writer works with the guideline coordinators and the scientists from NCCN to make sure that this information is appropriate and needed for patient information. So it's a team effort.
So how many panel members are there for the gastric cancer guidelines?
There should be 30 panel members, because there is usually representation from each member institution. It's a multidisciplinary panel. And then there is also a patient advocate on our panel. So there's between 30 and sometimes 32 panel members.
Great. How are the panel members selected?
The panel members are selected from their member institutions through their guideline steering committee representatives.
Okay, I'm newly diagnosed and keep hearing the term standard of care. Is the treatment listed in the guide referred to the current standard of care across gastric cancer treatment?
Yes, the term standard of care is used to describe treatment that is accepted by medical experts as proper treatment for a certain type of disease that is widely used by healthcare professionals. Other names for standard of care include best practices, standard medical care, and standard therapy. All of the treatment options that are presented in the NCCN guidelines for patients are widely used and accepted by cancer experts as appropriate and recommended options for cancer care. In order to determine which of the recommended options is best for you, patients are always encouraged to discuss them with their physician and members of their treatment team. And that's why these guidelines we feel are so important, because the medical professionals are using the same information. So having a patient version of that puts everybody in the same playing field and is able to facilitate conversations and making sure that the standard of care that is appropriate for your diagnosis.
I echo that. I know a lot of our patients refer to those guidelines during their treatment because it's so easy to read, easy to digest, and I think it's a great resource for the stomach cancer community.
Thank you.
Okay, next question. Does insurance company use this guide as a resource when approving treatment?
They do not use the patient version as a resource when approving treatment. However, all of the recommendations that are in our clinical practice guideline are used by CMS and all insurance companies to determine coverage. That's why it is so important for us to keep them updated as frequently as possible with new FDA approvals, new techniques, that we update them at least annually to make sure that patients have access and are being reimbursed for appropriate care. With that said, though, the same recommendations are in the patient version. So I guess in a way we could say yes.
I think that's an important piece of information for patients to know, that this is the main guide is kind of where these companies kind of get their approval denial information from.
They are the gold standard of care. They are used by physicians worldwide and by insurance companies across the country.
Okay, next question. Where can I get a free hard copy of the NCCN guidelines?
So free hard copies aren't always available. However, they are often available, I should say. So you can look on our website and see if there is a link to get a free copy. They are usually there, like I said, they are funding dependent. So sometimes there is a voucher program for different guidelines where patients or caregivers can go on and just request one. They are always available for download in PDF, and you can print them out very easily. There is, as I said before, a mobile app as well. You can get, if there is not a print copy available for free on our website, a lot of times you can go to Amazon, or they can reach out to patient advocacy groups such as yourself that is offering a free printed copy in the prepared kit.
Great. Okay, next question. What other resources did the NCCN offer to the stomach cancer community? I know you mentioned the survivorship guide, which is another great resource.
We also have, and we are working with partners to have a Know What Your Doctor Knows webinar series. So if that comes through, there will be, it's a 75-minute live webinar to discuss different treatment types. And with those webinars also, there are free printed versions, and then they will be on our YouTube channel.
Great. Next question. Does the guidelines address racial or economic disparities?
That is an issue that NCCN is working very hard to address and improve. It's something that we all need to work on improving. So recently, NCCN partnered with the American Cancer Society Cancer Action Network and the National Minority Quality Forum. They convened to have, it's an Elevating Cancer Equity Working Group of national experts. And in their working group, they developed recommendations for practice and policy change. They do have several recommendations that the webinar was just on Monday. So they have several recommendations that they are going to try to put into policy and make change.
That's great. Well, thank you so much for sharing your expertise and knowledge. Unfortunately, we're out of time for more questions, Dottie. I really appreciate you joining us today and doing this webinar for us. Great.
Thank you so much. It was my pleasure.
And again, I'd like to thank our webinar sponsors, Merck, Astellas, and Bristol Myers Squibb. Thank you, everyone. Have a wonderful day.